Healthcare settings. Potential job sites, Part 1. Government healthcare agencies generally will determine programs by a mandate. Government jobs are accountable to taxpayers as well as the government itself. Direct healthcare services are sometimes provided, and these monitor the incidence of disease and injury in the community and develops preventive strategies to maintain and improve the health of the public. They help ensure food safety, water quality, and protect the public's health and safety from harmful conditions in the environment, from animal-related injury, and from disease and nuisance hazards through the enforcement of health and safety standards. Some of these programs would be like AA World Services or Al-Anon Family Headquarters or the American Foundation for AIDS Research. When we're looking at voluntary public health care agencies, voluntary healthcare agencies determine their programs by supporter interest. We do have to realize that both types will operate at the local, state, federal, and international levels. So different local government agencies might be the city or county health department. These are funded by local tax money and subsidies from the state and federal levels of government. They carry out state laws which are mandated concerning community health. They also carry out non-mandated programs such as health promotion programs. At the state level, we have to realize that each state has a state health department, and these also are funded by state tax money. Sometimes they do receive some money from the federal government. And then at the national level, we have the Department of Health and Human Services, or DHHS, that's concerned primarily with health, and that's the United States Public Health Service. They are funded by federal taxes. And the head of the agency is appointed by the President of the United States, who advises the President in health matters. It's made up of 8 agencies, which is the Food and Drug Administration, Centers for Disease Control and Prevention, National Institutes of Health, Health Resources and Services Administration, Substance Abuse and Mental Health Administration, the Agency for Healthcare Research and Quality, Agency for Toxic Substances and Disease Registry, and Indian Health Services. And then government agencies on the international level are like the World Health Organization, which is an agency of the United Nations that's located in Geneva. A major objective of the World Health Organization is the highest possible level of health for people all over the world. They define health as a state of complete physical, mental, and social well-being, not merely as the absence of disease or infirmity. This program or agency is funded through fees that are paid by member nations of the United Nations. So let's look at some voluntary healthcare agencies. The focus of voluntary healthcare agencies is education and research. Their services are complementary to those that are provided by official health agencies. They are nonprofit, services are provided by volunteers, and LPN students and LPNs can provide valuable service and gain experience through their volunteering. The Visiting Nurse Association is an example of a voluntary agency. This agency provides home nursing care for patients that have acute and chronic diseases. They often meet the needs of patients with specific diseases such as heart disease or certain segments of the population such as the disabled. Care includes health supervision, education, counseling, bedside care, and carrying out physician's orders. They make visits with mothers that have newborn infants. They engage in health teaching. They involve the family in the care of its own members. They assist with referrals for patients to other community services. And the staff is Bachelor of Science in Nursing nurses and home health aides. With private healthcare agencies, the greatest challenge in healthcare services have been noted by these agencies. Their primary emphasis is going to be on curing disease and illness, with a change in emphasis to include disease prevention and wellness promotion. They also complement and supplement government health care agencies. They are owned by corporations that own a chain of healthcare facilities, or they are owned by individuals who practice within the agency. With private health care, this is the family practice physicians that deliver primary care. They can refer you to other physicians as necessary. And private practice nurses are the advanced practice nurses that counsel individuals on different healthcare issues. Proprietary or for-profit hospitals. This type of care is referred to as acute care because patients are more acutely ill and they require more skilled care. The owner of these facilities can be individual, a partnership, or a corporation. There's a lot of teaching and research hospitals that are out there. The goals of these hospitals include treating patients, especially with those that have serious or unusual conditions. They are also training sites for physicians, nurses, or other health professionals. And they also have a goal of researching and developing treatments for disease conditions. Public hospitals will be those hospitals such as the VA, a state hospital or county hospital, or one that is owned municipally. For example, Pratt Regional Medical Center is a county-owned hospital. There are some hospitals out there that still continue to be funded by federal, state, or county funds, such as those people with serious mental illnesses. There's also voluntary community hospitals that are operated by community associations or religious organizations. Ultimately, responsibility for the hospital in these types of facilities, will rest with the Board of Trustees that are usually chosen from the community's business and professional people, and they serve without pay. So let's look at ambulatory versus acute care settings. Ambulatory services will include outpatient clinicals, ambulatory care facilities such as urgent care centers, and ambulatory surgery centers such as outpatient surgery facilities. In the private sector, you can see hospital outpatient departments or physician group practices or freestanding ambulatory centers. In the public sector, you'll see those like community health clinics and the Indian Health Services. So one reason why we like ambulatory care is it's usually less expensive. There's not as much financial outlay to run these. They manage disease on an ambulatory basis for those people who do not need to be hospitalized. So they're going to also provide coordination of care and follow-up care to clients after hospitalization. Part of healthcare facilities they may be part of a healthcare facility, or they might be freestanding where they're not attached to a hospital. They function by appointment only, and they include specialty areas such as diabetes or neurology, allergy, oncology, etc. The number of specialized clinics will depend on the population of the area, and these clinics do employ full-time staff. Urgent care centers, for some individuals, they do replace doctor's offices. They provide an alternative to care by a family physician or care offered in a more expensive emergency department. They are for clients who desire a quick service outside of regular office hours. They do provide services for walk-in patients also. They do make primary health care available, and they are frequently utilized by people who do not have a family physician. Names that reflect the type of care provided are convenience clinics, quick care, and urgent care. With the one-day surgical centers, surgery is performed at a scheduled date and time, and they eliminate the need and monetary charge for being hospitalized overnight. Outpatient surgery services are also provided within an established hospital, though. Patients are discharged when they've recovered from anesthesia and they are considered to be in stable condition. These can be freestanding outpatient surgery centers that provide outpatient surgery as their only service, or again, they might be part of an established facility. Approximately 80% of surgical procedures are performed in this type of setting. Acute care. This is inpatient care in general and specialized hospitals. They are for patients who are acutely ill and they require more skilled nursing care. They can be critical access hospitals. They're certified to receive cost-based reimbursement from Medicare, and reimbursement is intended to improve their financial performance and reduce hospital closures. It is critical for facilities to obtain critical access hospital status. Current licensure as an acute care hospital is required, and it must be in a rural area that's over 35 miles from another hospital or 15 miles in a mountainous, rugged terrain. Some regulations are that they have to have acute care beds and swing beds with a maximum of 25 acute care beds, and they must maintain an average length of stay of 96 hours or less in the acute beds.